Are you dealing with sciatica and not sure what to do about it?
Well, you're in luck because in this video, we're going to explore 7 different options to self-treat it and calm it down and maybe actually get rid of it. I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we are the most famous physical therapy team on the internet.
In our opinion, of course, Mike. Good call.
So first we want to explain what is happening when you have sciatica, and typically it involves a herniated disc pushing on your sciatic nerve root.
That's right. And once one of those nerves become irritated and compressed, it'll send pain, numbness, tingling down one side almost, and it can go all the way down into the toes when it's at its worst. So we're going to explain how that works, and we have a model here. Can you show what level they're at using that model?
So we're at the L4, L5 level. This is your lumbar, 4th vertebrae, and 5th vertebrae. And here you
your
can
hand's
see,
in the way. You can't,
here you
go.
can see is a disc. These discs are all normal, and this one has a protrusion, and it's red, and it's hitting those nerve roots, making that sciatica pain worse. And what causes this, Brad?
That's right. So if we look at that bulge, this model really does a nice dynamic description of it. Display of it, I should say.
Representation?
Representation, exactly.
There we
go. So as you may bend forward, and it pushes the internal content of the disc out, and it bulges, and it pushes into the nerve. It's not exactly like this. This is a little bit exaggerated, but you get the idea. Now, if you go sideways, it can actually come out from the side. So either way, it doesn't matter. Well, it doesn't matter which way it goes out, but it will pinch the nerve, typically a peripheral nerve, which means it's going to go down one side. Very common.
Now, your spine can normally handle these, but over time, consistently doing it, and maybe you're holding weight while doing it, it's going to be problematic, and you won't even feel the pain initially. It could take years, but once it manifests itself, it's hard to get rid of, and it's quite annoying.
All right, so let's get to the 7 things that you need to try and see if you can alleviate or get rid of this pain.
The first thing we want to do is try to keep your spine nice and neutral. We don't want to be too flexed over. I don't know who sits like this, but you want to show some flexion there?
Yeah, I mean, so we're talking about the low back. If we're flexed, it means we're leaning forward like this for whatever reason, not being aware of our spine posture. Or in a chair, maybe we're sitting like this or like this. Either way, the spine is flexed, and it has more potential to have that bulge to go out and press into that nerve. So we're going to scoot our butt back into the chair, sit upright, and what works really well, and it doesn't cost anything except for take a pillow from the bed, put it vertical in a chair, and use that, and it helps your spine stay in that neutral position. It's comfortable, and it really works well.
Now, if you're sitting in a couch or recliner that's kind of wore out on the bottom, you can take a smaller throw pillow and put it behind your low back, and that may work as well.
That's right. Right in there, you know what I mean? Some of these older, even newer ones that aren't built well have a big hollow spot right above your belt. Fill it in with a pillow for good support.
Now, the next tip to try is to actually stretch out your hip flexor. Now, you're thinking, I have back pain. What the heck does that have to do with my hip? If your hip flexors are tight, they can essentially tilt your pelvis anteriorly or forward, and you can see the back is going to arch more, causing a different pattern and can cause some sciatic pain to happen. So what we want to do is stretch out these front hip flexor muscles and see if that can help.
There you go.
So there's numerous ways to stretch your hip flexors. Most people are uncomfortable kneeling down, but there's a simple way. If you lay off the edge of the bed, hopefully your mattress is firm. You can try it on the kitchen table or cupboard if you can get up there. But what you're going to do, if I'm going to stretch my left ones tight, I'm going to bring both knees to my chest. I'm going to drop this down in a straight line. Now I'm going to bend my knee on this side, bring the opposite knee to your chest, and you're just going to hold this for 30 seconds or so. You notice once I pull up, my hip comes up a little bit. That means I'm a little tight there. You're going to do one side, reset, and perform on the other side. You may notice one side is tighter than the other. Most commonly, if you're having sciatica and this is helping, the side is going to be tight. That your painful side.
There you go. So again, be careful with this one. If you're sciatica is flared up and it's uncomfortable to get in this position, you'll have to wait until things are feeling better and go to the next option.
Then one nice thing about this stretch for sciatica and stretching your hip flexor is your back is supported and it's in a neutral position already, so that's going to help. If you're doing a kneeling one, some people might arch their back too much and it could hurt. So there you go, just like that.
Yeah, that hurts my knee. That's why I don't like to do that one.
All right, tip number 3, we need to set up our props.
Okay, we'll take a break. Now, the next thing we need to address, particularly if you are in a car for an extended period of time, is your seated posture in your car. You'll know it's bad because when you drive, your sciatica gets worse, and it may be able to get corrected by simply changing the position of your back. Some people, and I've had many patients, I say, do you adjust your lumbar support? And they say, I don't even know if I have one. So we go out to their car. Sure enough, they have a button, and you can adjust the lumbar support to get it in a comfortable position. You may not have that, you can simply use the pillow trick that we talked about before and use that in your car seat. Make sure you adjust your seat forward and backwards so it gets you in a comfortable position. It can make a tremendous difference while you're driving. This is a nice steering wheel.
Yeah, it's our new Bob and Brad steering wheel. Buy now.
All right, let's go on to the next option.
The next tip is to strengthen your hip abductors. These are your glute medius and minimus on the side of your hips here. What they do is keep you upright when you're walking. Some people that have back pain have weak hip abductors, so we're just going to strengthen them. You can do it many different ways. For beginners, we'll just stand and you can kick out to the side. Make sure to hold on to something if you have pain or you feel unsteady. I'm bending my knee on the stationary leg, so this hip abductor is working to keep me upright. We're going to do 10 to 15 reps, and then you're going to switch sides. Notice we're not rotating our toes out to the side because those are different muscle groups. Nice and straight, good posture. If that seems easy for you, you can take a loop band like this. You can take a cuff weight. You can take a big band like this and just put it around your hips, and then you got some resistance to make it harder because we want to progress over time, build up those hip abductors.
Big thing not to do that is a common mistake is this. The upper trunk needs to stay stable and upright, so we isolate those side muscles so that pelvis stays stationary, helping that back.
Now with strengthening, you can just do this every other day, Monday, Wednesday, Friday. Just do the strengthening exercise. Let them rest the other days and recover. What's our next one? Oh, walking with soft knees.
There you go.
Now this pertains to many other joints in your leg and even your low back. So most people commonly walk around with a heel strike, a straight leg like this. The impact forces are going to go ankle, knee, hip, low, back. If we can put a bend in the knee, some of the shock absorption will go into the muscles, so it can take pain off of your low back if you're experiencing it. So what we suggest is when you're at home, walk around barefoot or in slippers, maybe socks if you feel comfortable. Do your normal walking pattern like you always would. And place your hands on your buttock while you're doing it. Feel how much your glutes are or are not engaging. Then we want you to go on your tippy toes. Now feel how much your glutes are engaging. They should be activating a lot more this way, so that means you're doing it right. However, we're not going to walk around on our tippy toes all the time.
Yeah, this tippy toe thing, I don't go for it. Ain't no one's going to walk around
You
on
can
their
feel it, though, the
toes.
activation of your actual muscles.
I'm saying, yeah, just walk on your 4 feet like that so you're balanced.
So just make sure to have a nice soft bent knee. You can land slightly on your forefoot or with a flat foot in the house. You're going to take shorter steps, but if you're noticing your back pain is feeling a lot better, then this is the right step for you.
Right, and this is one of those things where we've had people, you change that, and they say, oh, walking's not so bad anymore. You'll know right away.
What's the next one?
Ooh,
glute strengthening.
glutes.
So some people have what is coined as gluteal amnesia, meaning their glutes aren't firing properly. Changing your walking pattern can help, but if you're still not feeling a lot, a way to isolate your glutes is to do some glute pumps. Now, you can do this in a standing position if you are not comfortable getting on your hands and knees like this, but if I'm doing my left one, I'm not going to do the full glute pump you commonly see. We're going to go somewhere in mid-range here, and we're going to do little oscillations, do 30 repetitions total. And then if you're not feeling much activation, say your hamstrings are kicking in too much, turn, and then we're going to do it this way. If you need to do 3 sets of 10, 2 sets of 15, Do all 30 at once, whatever you're comfortable with. Just make sure to work both sides.
That's right. You can also do this one standing. I'll demonstrate here. Hands on a cupboard or a firm piece of furniture. Keep your back in that neutral position, not arched this way or rounded. And we'll do the same motion right here. Get that butt muscle firing. You'll feel it. Rotate it in. Again, 10 to 20 and up to 30 reps as you feel stronger. Okay, very good. Let's go to the next. This next stretch actually is going to open up that side, releasing that pressure from that disc bulging out, and you can do this. You can do it with a doorway if you're tall enough or not too tall. Mike will demonstrate it that way, and I'll demonstrate a way if that's not an option for you.
So you're going to lean into the door frame with your painful side going in. You could do this on a pull-up bar too if you happen to have one at home. My palm is going to face away from me. We'll say my left side is a painful one. I'm going to lean into the door to start. And then I'm slowly going to bend my knees, and I'm just going to kind of hang, but I still have pressure through my feet. This is going to decompress that spine and give you some pain relief if you're having an episode of pain. It's also going to stretch out all these muscles in your back that may be tight. So you're just going to hold this for about 30 seconds. You can do it on both sides if you want, but you mainly want to focus on the painful side.
That's right. If that does not work for you, you don't have a good handhold on the door, you're too tall or too short, you can simply take a booyah stick or just any kind of a broom or handle that's strong enough, maybe a piece of doweling or PVC pipe. You need a rubber tip. If you don't have that, simply put it on a shoe on your cupboard or chair so it does not slide, palm away. And again, I'm standing here, I'm leaning. That's putting the stretch right through here. You can see my shirt is starting to tighten up, and that's what's going to happen with your muscles. They're going to stretch, relax, and I'm bending my knees to get an adjustable or variable stretch on there. Again, it should feel good feeling that open up and allowing that bulge to get back in, or they call that reduction, and that feels good.
We should mention if you happen to be walking and you're having this pain and you know that helps, you can try just sticking your arm up in the air for a little bit while you're walking, then put it behind your head and then down at your side if you're having pain while walking.
Yeah, so you find yourself walking down the sidewalk like this and feeling
people,
good. And yes, people will talk.
Yeah, they always do. Anyway, if you want to check out, maybe we should say give all 7 of those a try.
Yeah.
And see which ones work for you. You
Right.
do not have to do all of them. Pick out 2 or 3 and make sure to stay consistent with it if they're helping your pain. And what else should they do? Because Danny's typing it right now.
Well, actually, you'll find that maybe 2 or 3 of them clearly make the pain better or down the leg, but after a week or 2, they change. Go back to this and retry some of the other ones because that's a progression. Sometimes you may end up not doing well with the one on the door or the stick, but later on as things progress, that becomes one that works very well. So you need to work with it. You'll learn very quickly how your body responds. Oh, yes.
If you like this video, make sure to subscribe to the channel. We're always putting out content 4 days a week. And if you want to see more videos on sciatica, click the video link on the screen.
Right. Only 1 in 5,000 know this about treating sciatica.
Yeah.
Yeah,
5,
so we're trying to make that instead of 1 in 5,000 much more. All right, take care and enjoy. Good luck with your sciatica.
Bob and Brad, the 2 most